the last 2.5 years that we have been actively using AI. And for us, it's really been a game changer. One thing which is sort of the bigger surprise, it may be a smaller percentage of the patients, but the critical unsuspected finding. So we all look at the ERs, we know the stats have to be read, the case that comes in as a CT pulmonary angiogram is prioritized, but all the oncology surveillance patients, hundreds of them, and the patients with headache and all these things that are unsuspected. Well, the patient just spent 6 hours in the clinic. They had their infusion, they saw their doctor, they had their CAT scan, and they're out the door. But now we have point of care diagnosis of PE, because those patients have a really high incidence of 1 to 5%. I mean, we've probably hear about 3% of the cases. And so before that patient leaves, I can call the oncologist and the patient's still in the department and say, hey, your patient has pulmonary embolism. And I hate making that call after hours. I don't like it making it that night, and I certainly don't like making it 24 hours later, which is when that call would ordinarily be made. So making that call when the patient's still in the house is huge. And our referring physicians have been completely wowed by that.